Hi, good afternoon. My name's Shannon, obviously. After watching your video today, I thought I would post a little video posting on the matter. It's been issues with me over the last couple of months. Some thoughts here I wanted to address in regard to self-medicating. Currently, and all up to this point, I've always been under doctor's supervision for my hormone replacement therapy. Like yourself, I kind of take a posture of a middle of the road, neutral, riding the fence, as opposed to people's decisions in self-medicating. Um, I'm not going to point fingers and I'm not going to ridicule and judge other people for their choices here or whatever it is they do in their lives. Um, it's a personal call, and all I would mention here is that from my perspective and from the year and almost a half that I've experienced hormone therapy with doctors, I do not endorse self-medicating. I would not encourage anyone that hasn't begun hormone therapy to go out and pursue that. I would I would encourage strongly that they see their doctor or physician or some medical resource to get the appropriate attention needed. Um, but then there's the girls that are self-medicating, and I'm not judging any of them. Um, I just hope that they do, and I think the majority are as well concerned with their overall health and hopefully are taking some kind of measures to monitor themselves and see that they aren't doing something so out of line that it could hinder their progression, number one, and their overall health, that they're not going to kill themselves or you know create health conditions that could be avoided, um, if that's possible. But so back to, do we self-medicate or see a doctor? Well, I did some self-medicating, and I'm not saying that, endorsing it and saying that it's okay to do so. I'm guilty of doing some self-medicating prior to or during my therapy. It was one of the things that brought me into therapy, and I think I really kind of subconsciously made the decision that I was going to transition and found myself there. But I was taking such low doses because of the fear I had and the things I had read and what I had learned about self-induced hormones. So anyway, I don't again encourage anyone to do that. But here's an argument. Almost a year and a half into hormones, I have seen some significant progress or whatever changes, and hopefully more on the horizon. But also along with this has come a lot of frustration in not getting a regimen that I wish to alter. Um, I've heard and read and just researched and found that if something's not really working, or you think, you get to try to know your body, like you mentioned, and I think I know mine pretty well. But when it comes to something like this, I really feel like the professionals should know and do know what they're doing. And it's why I kind of call them gatekeepers in the same breath, if that makes any kind of sense. But I don't think these doctors are on the bandwagon to really support and help us get to where it is we wish to go and what we wish to accomplish by taking hormones. I think the greater majority of them take a very um, or are very reluctant to prescribing hormone therapy and supporting a transgender in doing so. I think they're apprehensive in their approach, and I think that they're very conservative in their approach. The majority, not all. So it's finding those that aren't, that might look at this with an aggressive approach and say, yes, this needs to be done in order to get the overall results that you're desiring. This is all not all guesswork on my behalf, but a lot of research has gone in it, a lot of process of elimination and those kinds of things. But I want to be on injections or try injections. I want to alter my program because it's been nothing but an oral program up to this point. And I'm not dissatisfied, but I want to try something else. And as long as I'm under their supervision, why not? Because they're monitoring me. If we get an adverse reaction to the changes, then I would be the first one to raise my hand and say, okay, let's get back on course here or whatever. But why not try something else? And this is one of my arguments to them. And the only alternative I have to this, if they're not going to allow me to change or alter my regimen, is to self-medicate. And do I want to do that? You know, part of me does because I can self-prescribe my own dosage and get what it is I think I need and want. But that doesn't necessarily make it right. So I don't want to override what they're telling me is best for me. So it's very, very fine line here. I'm unhappy, I think, right now with oral procedure. I mean, I'm sure it's fine, but I just want to try something else. And if I'm under their supervision and their care, I don't see any reason why not. And for me to go self-medicate and then come in and tell them that I'm doing so, I might lose their support, if you want to call it that, or they may not want to give me attention anymore, or I don't know what their reaction to that behavior would be, but I don't think it would be a good one. So, and to go into any other doctor and tell them that I'm self-medicating, I think it puts me in a position in the doctor-patient relationship in a bad position to begin with, because I don't think doctors are very excited about that. I think that they look at those people that self-medicate and self-diagnose and these kinds of things and come in and expect them to take care of them at this point. I think they look at all of them as a very high risk and a potential of lawsuits and liabilities. So these are some of the things I think that a lot of people need to take into consideration when they're going to think about self-medicating and then running to a doctor for some help. So, just some food for thought. On the other hand, with my current regimen, it's not a bad one, and I'm still going to try to get it altered, and I may get some more opinions, but like you mentioned, I'm one of those privileged people, if you want to call it that, to this point, that the doctors identify, who I am, what's going on with me, and then I'm following the proper avenues to move forward. But when it comes to billing insurances and my claims, they're able to do all my blood work, all my office visits, all my hormones, everything's covered under my insurance that's provided from my employer. I need to, just in my transition as a whole, go and change my name and get the M changed to an F and do all the legalities that need to be done. Do they have to be done right now? And I sound like I'm procrastinating, but it's for those reasons. If I go put an F, my middle name is Shannon, and I'm going to adopt it as my proper name. If I go change all my identifications and put an F on my credentials and start presenting full-time as a female and doing so in all areas of my life, I'm going to lose my insurance. I'm going to lose my coverage, health, just my general health insurance altogether. I'm sure of it. So I don't know that it's worth it for that change. So these weigh heavily on my mind and my decision making in this whole process, because my doctors have been very cooperative and somewhat supportive in working around that, because they want me as a patient, because